it'll be recorded for later viewing. Okay, we are being recorded. Welcome everybody to the webinar on for GC America. The presenters, Todd and Michelle and Adam, will be talking about how Glass Ionomer works and how it bonds to the tooth, as well as techniques that have traditionally been used and that are modified to use during COVID-19. And let's see, and please, Amy wrote in, please type your questions into the chat box. And I am going to turn it over to Todd from GC America to say a few words. Okay, Todd.
Okay, good afternoon, everyone. Thank you for attending. I'm Todd Cretors. I'm a regional manager with GC America, and on behalf of myself, Michelle, and Adam, and all GCA associates, we wanted to thank Karen Phillips and the state of Oregon, the Sealant programs, for the opportunity to present today. The GC Corporation, or maybe you fondly know us as the Fuji folks, gosh, we've been around a while. We're 7 months short of our centennial birthday, 100 years old next year, and we're not a company that's a mega corporation or a conglomerate that's publicly held or publicly traded. Instead, we're a privately held dental manufacturer that happens to be the world leader in glass ionomer technology. Also being privately held, it gives us some advantages of being able to roll back some of our profits and proceeds into our R&D arm, which is known throughout the industry as being prestigious and really a cutting edge R&D firm that's evidence-based. It employs 200 plus workers. And, they are always challenged with the innovation, development, test, and confirming and bringing to market the highest quality dental materials that are available out there today. So with that being said, it does have the advantages of being privately held, but without further ado, we're going to get into the presentation now. We'll talk a little bit about minimal intervention dentistry, glass ionomer options and effectiveness, and of course some very specific placement techniques. So again, a big thank you goes out on the front end for you taking time out of your day to join us. And without further ado, I'll turn it over to Michelle Wright.
Oh, go ahead. I'm sorry. All right. So thank you, Todd, so much. I appreciate that introduction, and I am very happy to be doing this presentation. From my understanding, I think some of you may have heard this presentation before, so I did try to do my best to change it up a little bit, but I appreciate everyone that's in attendance today. You guys will get a live CE credit for today's presentation. So what you'll have to do, because this is a virtual presentation, the way GC does this is you will actually have to log on to the link you see provided here. Don't feel like you have to take a screenshot. I will actually send this to Karen Phillips, and I'll let her maybe send it out to the team if she's okay with that. You'll have to take the survey. The cutoff on this is August the 7th by noon. Once you complete that survey, you will then be sent the certificate via email, but we do ask that you please allow at least 2 weeks to receive that certificate. And then also be sure that when you do fill out the survey that you put the email address where you want the certificate sent to. So if you don't check your work email very often, or maybe your work has a lot of spam filters, wherever you feel like, you're gonna most likely get that email, please be sure to put that. And again, I've got my contact on here as well. So if you don't receive that in a couple of weeks, please feel free to contact me. We'll definitely check on that for you. So again, I know you guys have already heard from Todd, but this is the team that we have with us today. Again, Todd Creeters, he's the regional manager for the Southwest region, excuse me. And Todd, you can reiterate this, but I know Todd has over 20 years of dental experience. We also have Adam Hart with us. He is the lead key account specialist, so he works hand in hand with Todd on a lot of our special markets accounts. And then my name is Michelle. I'm the special markets account manager, and the three of us together, we do work together to make sure that you guys are taken care of, because we really do believe that customers needs to find success. So again, Todd told you a little bit about our company. We are very excited that we are going to be celebrating our 100th birthday next year. I'm hoping, keeping my fingers crossed, COVID doesn't stop a lot of the celebration process, but we were established in 1921. We have over 14,000 products in our product line, from preventive, restorative, laboratory, CAD/CAM product. I know people know us as the Fuji people, MI Paste, but we have a plethora of products in our portfolio to assist you guys. Todd mentioned our R&D. We have over 200 people in our R&D department that are working tirelessly every day to help create products that create efficiency within your organization. And we're a global company. We actually sell in over 100 countries across the world, and we have operations in America, Europe, and Asia. So what are we going to talk about today? Yes, we are going to talk about glass ionomers, but we're going to talk about, minimal intervention dentistry. I think this is between the MI products and the glass ionomers. These two products really do help you guys practice minimal intervention dentistry. We're going to talk about how glass ionomers play a role in this, creating minimal aerosol workflow, because that is a huge deal with everything going on in COVID. We're going to talk about the effectiveness of GIs, a little bit of the science behind it, GIs versus resins. We're going to talk about techniques for placement. And I'm actually going to try to do some techniques for you. I'm going to spend a little bit more time. So those of you that have heard this presentation before, I probably quickly went through the techniques. I'm going to try to spend a little more time on the technique for placement. And then we're going to talk about some alternative options. So while the focus is going to be on Fuji Triage, sometimes Fuji Triage is not necessarily accessible to everyone, or they have different situations. We know every operatory is different. So I just want you to know that we have a lot of options for you guys out there. So again, my disclaimer is, if you attended a recent NOAA webinar, or if you are with the Advantage Dental Group, you may have heard some of this before. And so I'm always trying to think of creative ways to be a little bit different. But I heard a really great quote weekend that said that people need to be reminded more often than they need to be instructed. So I feel like maybe if you've heard this before, I'm hoping that maybe you'll pick up on something that you didn't before. And then I did try to add a little bit of different slides in it this time. So again, bear with me. Some of it will be review, but we're just going to call this a friendly reminder webinar. So let's talk about MI. What is MI? Everybody wants to know, what is MI and the MI Paste. MI stands for minimal intervention or minimally invasive dentistry. What is that? That is essentially the modern medical approach to the management of decay. So the days of, whether we're talking about pre-COVID, middle COVID, post-COVID, wherever we are, the days of drill and fill is not necessarily the standard of care anymore. With the technology that we have, with the innovative products that we have out there, used to G.B. Black, which is the father of modern dentistry, used to talk about extension for prevention. So the whole goal was, if you had a tooth that had decay in it, the whole idea was that you removed the decay, but you actually extended that prep out to try to prevent further deterioration. With the products that we have now, you don't have to do that. Your preps can be a lot smaller. Oftentimes we have products that will allow you to actually, seal up incipient lesions, or to place products that helps reverse and promote remineralization. So that's really the whole idea, is the modern medical approach to the management of decay. So I want you to keep this in the back of your mind when I talk about some of the techniques, because if you've never really practiced this before, some of this may blow your mind, but this is really becoming the standard of care in dentistry. So minimal intervention, I like to think about this when it comes to dentistry as a puzzle. First you have to identify. So we have to recognize what's causing dental caries. It's just like any other disease out there. The way you treat and diagnose patients, or diagnose and treat patients, really depends on what's causing dental caries. So first we have to recognize what's causing their issues so that we can have a risk assessment and treatment plan. And then we come up with a preventive plan. You know, we have ways to help rejuvenate tooth structure, help remineralize and strengthen the enamel. And then not everything can be, you know, strengthened and remineralized. So there are products we have that will help you be conservative in your restorative product. But from my understanding, I think a lot of the attendees here are hygienists or have been in a hygiene role before. I want you to notice that they identify in the prevent aspect. Most of the time, those two pieces of the puzzle fall into your category. So again, a big part of what we do with minimal intervention dentistry falls in the hygiene sector. So glass ionomers, you know, glass ionomers are essential in the clinical practice because of the following. They're very versatile. You know, GC, we like to talk about glass ionomers as like dental duct tape. I mean, they're very versatile. They can be used for a plethora of ideas, for sealants, for cements, for restoratives. They're very versatile. You can use them in a lot of different aspects. They're self-adhesion to both enamel and dentin. They have great biocompatibility. They have chemical cure versus a mechanical cure, and we'll get into a little bit of that in just a few minutes. And typically you have no shrinkage stress with glass ionomers. So a lot of times why glass ionomers are really great, especially with helping with sensitivity, is, you know, glass ionomers expand and contract. So typically where sometimes the resins will shrink, or, you know, as the tooth, we eat or drink something hot or too cold, the teeth kind of expand and contract. Glass ionomers expand and contract with that. So it creates what we call the, what's the term I'm looking for? Has the same coefficient thermal expansion as dentin. So that's why a lot of times we like to use glass ionomers, whether it's for a final restorative or we're using it as a base because it helps cut down on that sensitivity. So again, because they're versatile, they're biocompatible, and all of these indications here, glass ionomers are very well suited for minimal invasive, preventive, and restorative techniques. So how does MI dentistry play a role in the COVID world? So I understand that there may be people all over the country that may be listening to this webinar, and so I understand that everyone is in different phases of their reopening. I'm sure you guys picked up on the accent here. If you don't know me well enough, I'm from Birmingham. But our dental offices here have been opened up since the middle of May, so a lot of our clinics are rocking and rolling. But I know that there's some people on the East Coast that are just now starting to open. Then also know that the CDC has guidelines, the ADA has come out with things, and then you have different states that give you guidelines. We also know those guidelines are not only different, but the interpretation of those guidelines. A lot of times there's a lot of gray areas. So I go into offices that are practicing with no aerosol usage, and then some that are still going full-blown aerosol usage. So again, what I'm finding though in a lot of the corporate offices is that they do have very similar guidelines. So what does that look like? You know, in a hygiene sector, you know, we're talking about eliminating or minimizing aerosol sprays. A lot of offices are saying that they're encouraging their clinicians to utilize hand instruments versus sonic or ultrasonic instruments, modified plaque and stain removal versus full mouth coronal polishing. Some offices are saying absolutely no use of air polishing, no use of air water syringe. And then, you know, a lot of people feel like, well, if this is the case, it really limits some of the procedures I can do. Absolutely not. This is where utilizing hydrophilic sealant materials come into play. I'm actually working with a group right now that the only sealant material they can use right now is Fuji Triage. So before, where they thought they didn't have an option for placing sealants, they're now able to do so. And now is probably a more critical time than ever to actually be placing these sealants on patients, and not just children. I mean, you know, there's a lot of studies that advocate for actually placing sealants on adults as well. And then also some additional modified techniques. We know modifying these techniques, so the whole objective is to provide long-term dental care while minimizing aerosols. And so this is going to be different from state to state. I know some hygienists can do expanded duties, but essentially what we want to do is we want to think about the management of cavitated caries lesions in vital teeth, incorporate minimal intervention dentistry, which is the removal of soft and moist discolored dentin. Sometimes that involves with a hand instrument such as a spoon excavator or a slow speed burr versus the high speed hand pieces. We want to focus on leaving behind the hard dark colored dentin. And then we want to eliminate or limited excavation in deep cavities. We want to make sure that we obtain margins and sound dentin. And then Restore, what we can help you guys restore with glass ionomer or glass hybrid restorative and preventive products. So how effective are GIs? Because if you've never worked with glass ionomers before, or maybe you haven't read a lot about them, they're actually very effective. And I found this resource online from Oral Health, and I just copied this verbatim because I felt like this was, you know, a great, this is probably one of the best ways that you can explain why glass ionomers are so effective. So they say, and I noticed in parentheses, they say glass ionomers cement. That doesn't necessarily mean luting cements. Glass ionomers in general are all a quote unquote cement per se, but they just have different chemistries that allow you to do different things with them. So this is talking about the broad spectrum of sealants, cements, restoratives. So glass ionomers release fluoride at around 1%. That's above 5,000 part per million, which essentially says that that will effectively kill any carcinogenic bacteria that is still present in and around the perimeter of the carious lesions. So glass ionomers protect the margins of the restorations from recurrent caries. Okay, I couldn't have said that better myself. I think that just wholeheartedly fits in with minimal intervention dentistry, and then also how we're having to minimize aerosols in our practice. But don't take my word for it. I'm not going to go verbatim about these, but for those of you that like to do additional reading, you know, there are tons of studies out there that back the efficacy of the glass ionomers. You know, the proof is in the science. You know, I love the glass ionomers, not because I sell them. You know, I practiced on the clinical side for 12 years. If I had to go back in the clinical side full time, I would definitely incorporate this into my practice. Not because GC has, I drink the Kool-Aid per se, but because there's enough science that backs efficacy. Glass ionomers are great for art technique, for prevention, for restorative. You know, there's just lots of things, and we'll pass this along to you as well. So if you want to do additional research for your clinic, you know, feel free. This is only just a handful. I could do slide out. I could probably do a whole presentation just on references of this, but we will pass this along to you guys. So for those of you that have not heard this presentation before, you're probably thinking, okay, what is a glass ionomer? Okay. You know, a glass ionomer, if you have or have not worked with them before, a lot of times they come in a capsule or a double barrel syringe. Essentially what it is, it's a base and a catalyst. So you have the base or the powder, which is a calcium fluoroaluminum silicate glass, or in some of the newer glass ionomers, it's a strontium fluoroaluminum silicate glass. That's your base. That's what that powder is, okay? And then you have a water-soluble polyacrylic acid, which is the liquid, okay? So what happens is both of those materials bind, and they have to be kept separate. That's why it's in the delivery system that it's in, is because once those two materials combine together, it creates a self-cured material, creating what we call an acid base or a chemical reaction. It releases fluoride, not just initially, but for relatively long periods of time. So the features and benefits of glass ionomers, they are hydrophilic. They work well in a moist environment, which is phenomenal in the mouth, okay? So they're moisture tolerant. They actually need moisture to bond to assist in that chemical bond. And so we'll talk about that in just a second. Very easy to use. A lot of times people think that glass ionomers are hard to use, but it's not harder, it's just different. Glass ionomers are not technique sensitive. They do release fluoride, and not just a little bit of fluoride, but they have exceptional fluoride release. We also get a recharge of the fluoride, so it helps promote the building of the fluoroapatite layer in the tooth. And again, it chemically bonds versus mechanically bonds to the teeth. So I like to take a few minutes here, because the difference is, and I'm not bashing, you know, resins. I tell people all the time, we have a lot of great resins in our portfolio. So I personally think there's a place for glass ionomers. I think there's a place for resins, and in some patients you can use the two together. You know, they work very well together, sandwich technique and a lot of different roles there. We have to think about resins and how they work, whether we're talking about a sealant, whether we're talking about a composite filling, whether we're talking about a cement. Typically what we do is we have to acid etch, which opens up those tubules and it allows the material to lock in there. Or if you're a visual person, think about your zipper on your jeans, kind of how that you have that interlocking reaction. That's how, kind of like how a mechanical reaction works. Chemical bond, what happens is it actually chemically infuses into each other. So if you look at this slide down here at the bottom, you can see the dentin, and at the top you can see the glass ionomer. And you can see in the middle, that chemical fusion zone, you really can't tell where that tooth surface begins and where that glass ionomer begins, because it literally chemically fuses into one another. It's almost like they become one. In order for that chemical reaction to take place, the glass ionomer actually seeks hydrogen ions to help with the chemical bond. That's why glass ionomers work well in a moist environment. So I always like to take a few minutes, because we're so used to working with materials that are technique sensitive, and everybody thinks it's just, how does this work well in a moist environment? And it's because of that chemical reaction. They need those hydrogen ions to help with that chemical bond, okay? Glass ionomers also keep bacteria out, and I'll show you a slide on that in just a few minutes, but it actually allows calcium phosphate and fluoride ions to penetrate into the tooth surface. And so some of the disadvantages of composite, again, if you're talking, let's just talk about sealants for a minute. If you've got a fully erupted molar, you don't see any signs of incipient lesions, you can get a dry field. Resin sealants have been known to be great. But we know that they're moisture sensitive, okay? We know that you have to work in a completely dry field. And when you're talking about children, that can be difficult to achieve, especially if you're working by yourself. There's no chemical adhesion. So because of the mechanical reaction, oftentimes you get shrinkage. That shrinkage can lead to possible micro leakage. It can lead to marginal discoloration, which also can lead to bacterial penetration. So oftentimes, what happens is you start seeing the breakdown of the resins around the margins, and that's where the bacteria leaks in. So again, there's no acid-base reaction, no ion exchange that takes place, and there's no fluoride uptake with composite. So let's talk about the glass ionomer sealants. The Fuji Triage is an effective way to treat and protect caries-prone molars. It's, again, I think that's a misnomer, because all molars are caries-prone, in my opinion. But I personally think this is the best thing since sliced bread. Again, it's not because I sell the material. When I was practicing hygiene, I used to struggle placing sealant. It's not that a sealant is hard, it's just the situation that you're given. It's really hard to keep that area dry, so I used to struggle placing them. I promise you, if I go back into practice full time, because I've actually placed these like on my nieces and nephews, I've gone into clinics and have done hands-on demo, this will be my choice of material if I go back into the practice full time. But let's talk about why. So the Fuji Triage have the same great benefits as the glass ionomers we talked about before. But in addition to, this is a self-cure material, so you don't have to light cure it. So the great thing about that is, if we're having to light cure, that's an additional instrument that we have to place in the mouth, which is additional sterilization, additional time with that. Glass ionomers, I used to target people with patients with partially erupted molars, but actually the Fuji Triage is beneficial on all molars, especially those partially erupted molars, okay? And I always mention that because we know the best time to do a sealant is when a tooth first erupts. But oftentimes they come in our chair and they're partially erupted. We know it could take a year to a year and a half before that tooth fully erupts. Well, in the meantime, that flap of tissue is trapping bacteria, is trapping food, and then oftentimes when they come in, they have signs of incipient lesions. Well, when it gets to that point, then it's too late. We also know that with partially erupted molars, it's hard to do a sealant because you can't get the area isolated. So that's what's great about Fuji Triage is you can go ahead and place a sealant, on a partially erupted molar. It has exceptional fluoride release. All of our glass ionomers have great fluoride release. The Fuji Triage and one other product I'm going to mention later on, these two products actually have 6 times more fluoride release than any of the other sealants or actually materials out there on the market. It has a rechargeable fluoride, so again, it promotes the building of the fluoroapatite layer. There's typically no need to adjust the occlusion. So oftentimes I get that question because glass ionomers do wear. They wear a little bit quicker than the resins do. And I actually experienced this with my niece. We placed the Fuji Triage. She was hitting a little bit high on it, and within a couple of days, she had worn into occlusion. The glass ionomer was not out. She had just worn into occlusion. So again, that's an additional handpiece that you don't have to worry about sterilizing. Maybe you have a patient that's afraid, you bring out this handpiece, that can be scary. So again, there's no need for occlusal adjusting. Fuji Triage is a low viscosity material. So if you're used to using, maybe you've assisted, or maybe there's doctors on here that have used Fuji 2LC, Fuji 9, Equiaforte, those are higher viscosity materials. This is a lower viscosity, so if you're used to working with resin sealants, this is going to mimic that. It's a little bit thicker than a resin, but it's a little bit easier to manipulate into the enamel. and it's cost and time effective. So you can actually do all 4 6-year molars in less than 5 minutes. As a matter of fact, I have some doctors that tell me they can actually, out of 1 capsule, get 6 to 8 teeth out of 1 capsule. So there's a pedodontist that I work with that told me that if all the teeth are erupted, 1 capsule, he'll just go ahead and do molars and premolars while he's up there. But we know most of the time we're presented with cases where we're doing all 4 6-year molars, and you can do all 4 6-year molars in less than 5 minutes. So the great thing about that is you can actually do this the same day as your hygiene appointment. Okay, so we know with COVID is actually telling us we really need to try to eliminate the amount of time that patients come into the office. So this will, you can go ahead and do the sealants the same day as they're appropriate, keeps them from having to come back. But even pre-COVID, I had offices tell me that the parents loved it because, let's face it, we were all busy, sports, activities, no one wanted, in place, no matter how much they love you, people just don't want to go to the dentist no more than they have to. So again, you can do all 4 6-year molars in less than 5 minutes, same day as the Pro-V appointment, and it's cost and time effective. It's really the ideal sealant material. So glass ionomer as a surface protectant, again, has exceptionally high fluoride release. So I like to show this because there's a lot of fluoride releasing products out there on the market. But if you look at this slide, if you look at that green line at the top, that's actually the fluoride release of the Fuji Triage. That red line or purple line in the middle is actually your average glass ionomer. So you can see those release a significant amount of fluoride. And then if you look at the line at the bottom is some resins that claim to release fluoride, but you can definitely tell just by this curve along the initial fluoride, it just really outweighs all the other products out there on the market. So let's face it, if you're using Fuji Triage for a reason, when you're using Fuji Triage, you're using it for a reason, and you're going to want that higher fluoride release. So does it really recharge fluoride? A lot of people go, okay, you tell me, get this initial burst of fluoride, and it, does it really recharge fluoride? So, I actually found a study, and I can pass this along to you guys, and the reference is actually at the bottom as well. But according to the Journal of Dental Research, GC Equiaforte and GC Fuji Triage contain a soluble fluoride and calcium minerals that's releasing significant amounts of acidic pH, okay? Then what happens is these materials actually absorb and release the calcium. So basically, they did this study where they used MI-Paste 1, which a lot of you guys are familiar with that. And once they placed the sealants, they actually were able to test the recharge of the fluoride using MI-Paste 1. And what they found is that these fluoride and calcium materials have the potential for reducing secondary demineralization. So yes, it has been proven that you do get a recharge with the fluoride. So I like to show this because people go, okay, how is this recharge taking place? So essentially what's happening is Fuji Triage has what we call a semi-permeable skin. So what it does is it seals the tooth, but that semi-permeable skin actually allows, it actually absorbs those calcium and phosphate ions. So if you look at this schematic here, this actually shows where the Fuji Triages have been placed. You can see it on the top. Well, you can't see my cursor, but you can see a layer on the top, and it's actually absorbing those calcium and phosphate ions and the fluoride ions. And then the last slide where you see that blue that's filled in, you can actually see where that's absorbed, and it actually starts that remineralizing process. So I also get questions about retention, and I want you guys to just hear me out for a minute. So glass ionomers have gotten a bad rep for wearing and washing out, okay? So here's the deal. I have seen Fuji Triage placed clinically 5-7 years post-op, and the material looked just as good as the day it was placed. I have also seen post-ops that were like 2 years post-op, and it didn't look like the material was in there. What studies have shown is oftentimes glass ionomers are not known to pop out like resins do, because resins have a mechanical reaction, so they will actually break apart. Remember, glass ionomers chemically bond, so they fuse into the tooth, almost like they become one. What happens is typically glass ionomers will wear down in those grooves. So if you look at this picture on the right-hand side, you can actually see right there in the middle, it looks like that groove is filled. You clinically cannot see that Fuji Triage in the patient's mouth, but when they actually extracted this tooth and did a dissection of it, that's actually the Fuji Triage that is still in there. What studies have shown is even if it's not visible, it's still promoting that remineralization, and there's typically no signs of incipient lesions because that Fuji triage is still absorbing and releasing the fluoride. Now, again, I know if you're like me, you're a visual person, and if you don't see it in your mind, it's not there. If you see the patient and you're just not comfortable, you can always place more Fuji triage on top of it. You know, it's not going to hurt anything to place, you know, another layer of Fuji triage on top of it. But again, you can always rest assured that if you have a patient that comes in, you know, maybe the patient doesn't have good access to care. Maybe, you know, their parents just don't bring them very often. We never know the situation. And oftentimes we see these kids, they come in and then we never see them again. And we often think, whatever happened, you know, to those sealants that I placed? You can rest assured that this sealant it's going to be in there years down the road. But I also like to include the picture on the left-hand side. This is actually, we had a hygienist share this with us, and this is Fuji triage placed 3 years post-op. So I think a lot of it depends on their bite, their chewing habits. There's a lot of factors that play into that, but you can see right here that this material looks just as good as the day it was placed. I've actually had patients sit in my chair where we've actually, you know, maybe another doctor had placed Fuji triage, and that patient was 21, 22 years old. And the great thing about Fuji triage is it continues to mature over time. So you think resins get hard, check a glass ionomer 10 years down the road. You will take your Explorer and be like, I have never felt a hard material in my life. So glass ionomers continue to mature over time. So I do want to talk about a couple of things that mistakes that clinicians make, and this is including myself, is when we're working with glass ionomers, we have a tendency to over dry the teeth. Now, you don't want the area pooling in saliva, but you definitely want saliva there. And I have done this myself. I've watched clinicians do this. I've watched doctors do this. I've watched residents do this. It's just, we go back and we treat it like a resin. It's just like we're ingrained that it's just, habits are hard to break. So we over dry the teeth. So you want to make sure you don't over dry the teeth. Again, you don't want it pooling in saliva, but I would almost rather see a little bit too much saliva than not enough, because remember that the hydrogen ions help with the chemical bond. Also, people have a tendency to acid etch the teeth with a phosphoric acid. Now, we recommend that you use a cavity conditioner, which is a polyacrylic acid. It's not the same as a phosphoric acid. Phosphoric acid actually pulls moisture out of the tooth and it'll dehydrate it, so you will get debonding issues if you use a phosphoric acid etch. Again, old habits are hard to die, so we treat them like resins, and we overthink the process. Now, most of you out there, I'm sure, are a lot better clinicians than I was, and you probably don't overthink things like I do. But at the end of the day, I think what happens, we overthink the process. So I tell people, don't overthink it. You know, the worst thing that's going to happen is, say you're practicing this and you place a material and you think, oh my gosh, is this too moist? What's the worst thing that happens? It comes out, right? It's not like it's the end of the world. I guarantee though, just don't overthink it. Just go through the process, okay? So I'm going to show you a couple of techniques, because I think sometimes one of the things I had noticed is we have Fuji triage techniques. And again, Fuji triage is not technique sensitive per se. So I think there's certain guidelines that you have to do, but there's different ways that you can manipulate it. So I like to show this because this was the original technique that was pre-COVID that was put in the packaging. So you'll notice here that you're going to identify the tooth or the teeth that need to be sealed. And we actually, for this picture, we chose a partially erupted molar. And you can see, I love this picture too, because if you actually zoom in, you can tell that that area is not pooling in saliva, but it definitely, you can tell that tooth is moist, okay? That's how you want the tooth to look. You want it to be glistening. Then we recommend that you pumice the teeth with just, a regular flour pumice. Then you're going to use your air water syringe to rinse the pumice off. And then you're going to place the cavity conditioner for 10 seconds, rinse it off, mix your capsule, place the Fuji triage. But we also work in a COVID environment now where we're trying to eliminate the aerosols. Not a big deal. You can actually replace those air water syringes. You don't have to place that. So we've actually developed techniques. Again, you're going to identify the teeth that need to be sealed. You can actually use, if you're not using any type of aerosols, you can actually use like a wet cotton roll or a toothbrush. You just want to figure out a way to remove the gross plaque off the teeth. Then you're going to place the cavity conditioner on the tooth for 10 seconds. okay? Then you can use a wet cotton roll to remove the cavity conditioner. So then you might say, okay, well, what if some of the polyacrylic acid is still there? Well, the Fuji Triage has polyacrylic acid in it. So it's the same polyacrylic acid that's actually in the glass ionomer. So if on a microscopic level, if there's still some of that on there, it's not going to interfere with the bond strength, okay? So again, identify the teeth that need to be sealed, remove the gross plaque, place the cavity conditioner for 10 seconds, remove it with a soil cotton roll, and then you're going to take the capsule. I'm going to go over this in more detail in just a minute. I'm actually going to show you. But you're going to take the capsule, you're going to depress that plunger there, you're going to put it in the capsule mixer for 10 seconds, place it in your capsule applier, put a little dab in the middle of the tooth, take your glove finger, do what we call the finger smush technique, and I will go over this with you in a minute. And yes, if you've never heard this before, that's probably blowing your mind. But keep in mind, we don't have to worry about contaminating the teeth, okay? So what we find best is just put a dab in the middle of the tooth, take your glove finger, work it in there, and you're done, okay? But I'll demo that here for you in just a minute. So again, mixing a capsule, it's not a big deal. I'm going to actually, I've got a little square in the middle. And again, I'm going to take the video off of me in just a minute. Again, people get hung up on the capsule. It's not a big deal. You know, it's very easy to use. Again, the capsules look like this. This is the plunger that I was referring to. The reason you have to depress that plunger is because, remember, we talked about glass ionomers have the powder and the liquid. So that powder and the liquid are kept separate. That little liquid is actually what we call a little bladder pouch. So once we depress this, it actually starts that mixing process. So you're just going to take this. A lot of people are scared. I don't know why, but just slam it down, and you're going to depress that. Then you're going to put it in your capsule mixer, and that's how you mix the material. It's really that easy. Once you do it like once or twice, you'll have the hang of it, and it's not a big deal. And again, I'm going to demo that here in just a minute. So I want you to think about all the opportunities out there for using glass ionomers. Partially erupted molars. Stop waiting on them to fully erupt. Again, we know it takes a little bit of time for those to fully erupt. Stop waiting. Go ahead and seal those molars. Fuji Triage is great when times it's hard to isolate. Remember, glass ionomers love moisture. Incipient lesions. Remember, glass ionomers release fluoride. Fluoride acts as a bacteriostatic agent and can either arrest or reverse that decay process. So I'm not talking about just full-on, full-blown active decay you need to extubate, but if there's a little incipient lesion or a questionable area, you know those areas where you see the groove looks a little dark, you can't get a stick, you can't detect anything on a radiograph, do we, don't we? Well, let's just put a watch on it because you want to be conservative. But oftentimes you're watching it get bigger. Why not go ahead and place Fuji Triage? And this is not just GC saying this. Again, the Dimensions of Dental Hygiene promotes this. There's a lot of studies that promote, let's go ahead and take care of those incipient lesions because that fluoride can help promote the remineralization. And then also environments that do not allow aerosol use. You can still do sealants. Don't stop doing sealants just because you can't use an air syringe. Again, you can still do sealants. This is a perfect time to do that. And again, they can be done as the same day as a Profi appointment. So the patients and the parents are going to love you for not having to come back. I'm sure they'll wave at you or somewhere, but they don't want to come back in the care if they don't have to. So indications for use. Again, the Fuji Triage is great as a sealant or protective restoration. You can use it in a class 5 at the gingival margin if you want a thinner film thickness. This is really great for those incipient lesions. Smart technique. If you guys are doing smart technique and you need a low viscosity material, Fuji Triage is great for that. And then I also have some references for you to look where we have a KOL that actually works for the pediatric office in Arizona, and she does the smart technique. She uses a lot of the GC products, and so she's got a lot of great videos that she allows us to share. So I'll share that information with you at the end as well. And just a couple of things that I wanted to throw at you. Again, Fuji Triage is the indicated material for sealants, but sometimes we have to remember glass ionomers can be very versatile, and sometimes we have to get creative in the materials we use. Oftentimes with resins, you can't be as creative with them. Glass ionomers, you can be as creative as you want to be with these materials. So I'm going to talk about, our Fuji Automix LC as a possible option, and then our Equia Forte just as options. And then again, you know, I would recommend if you're confused or you're not sure what you want to do, contact us. We can set up a webinar or conference call, and we can guide you through that process. So the Fuji Automix LC is what we call a resin modified glass ionomer restorative. So this material, it's very easy to use. You don't triturate, does not come in capsules. You can see at the top that this actually is an Automix syringe material. This actually has a high fluoride release. It recharges fluoride. Again, no etching, no bonding, works well in moist environments. This is a light cure material, or it's a dual cure, but you will have to light cure the material. And it's designed for a restorative, but you can use it as a sealant. It's an off-label use, but I do have clinics that don't have access to a triturator or an amalgamator, and so they do use this as an option. And I mean, it's perfectly fine. So again, I tell people we have to remember ionomers have very similar chemistry. The chemistry changes just slightly to give it, like for this one, they actually add resin in there because it does make it a little more aesthetic, and they can light cure it. But essentially the glass ionomer portion is very similar. And then of course they add some shading to that. It's just we designed one for restorative and one for a sealant, but they do the same job. So again, I'm just going to quickly go through this. So again, the Fuji Automix LC has great bond strength to both enamel and dentin. Superior fluoride release. Now, I will say this does not have as much fluoride release as the Fuji Triage, but still has a significant amount of fluoride release. You can see this blue line up here is the fluoride release from the Fuji Automix LC. The red line in the middle is our Fuji 2 LC, and then at the bottom is the Activa restorative, which is the kind of the buzz with the bioactive material. So it still has superior fluoride release. So where would you use? It's really indicated for class 1 keto patients, class 3 and class 5 restorations. You can use this in the SMART technique because even though this has resin in here, the resin component is very small. So this does not affect the bond strength like your traditional resins do. And of course, this is great for an off-label use as a sealant if you don't have a capsule mixer available. And I think there may be some people on here that may be using this or kind of using this interchangeably with the Fuji Triage. And so our Equia Forte. So I don't have a lot of customers that are using the Equia Forte for sealants, but I do have a few. And the reason being, this is what I'm finding. So I have a dentist in South Alabama that uses a lot of Equia Forte for his restorative. He's used to working. This is a much thicker, higher viscosity material. There are some studies out there that say that the higher viscosity glass ionomers actually wear a little bit better. So he likes it because it wears a little bit better, and he's used to working with it. However, his hygienist came to me and said, we hate this material. We're not used to working with a thicker viscosity. We're used to working with flowables. So when they thought this was their only option for sealant, so if the doctor is doing a sealant, he uses Equia Forte, which is fine. A lot of times when he's doing a restorative and he sees a tooth that needs to be sealed, he just goes ahead and uses the Equia Forte. His hygienists hate the material because they don't like the viscosity, so they use the Fuji Triage. So again, a lot of it has to do with the handling and what you're used to. The Equia Forte, if you've used Fuji 9, for some of you out there, it has a similar viscosity to that. But I like to show this because it actually has higher compressive strength. It's more wear resistant. And I do just want to show you, so this Equia Forte and the Fuji Triage, these are the two materials that have 6 times more fluoride release than the other glass ionomers out there. So I want you to look at the 1, 2, 3, 4th row down where it says initial fluoride release. Look at this fluoride release in the Equia Forte, and that Fuji Triage is going to be similar. Look at the comparison of those other products. Again, if you're using a glass ionomer, you're using the glass ionomers for a reason, and I would think about, you know, the higher fluoride releasing product. So again, the Equia Forte, high wear resistant, high flexural strength, high acid resistance, high fluoride release, high surface hardness, but it is a higher viscosity material. So its indications for use are class 1, class 2, class 3, class 5, pedo and adult of all ages, SMART technique if you want a higher viscosity material. And of course, an off-label use would be, you can use it as a sealant material too, if you like that higher viscosity. I do have a tendency to, I feel like my experience, and maybe Todd and Adam can tell you something different. I think my doctors like this a little bit more. than my hygienist, but again, you can't go wrong interchanging these products. So things to consider when choosing a glass ionomer. You know, what type of restoration are you doing? Are you placing a sealant? Are you doing mostly class 1, class 2? Do you see mostly pedo? Do you see geriatric? You know, what is your patient base? Viscosity, do you work better with a low film thickness or versus a high film thickness? You know, what is easier for you to work with? I think at the end of the day, you know, whatever works best in your hands is going to be most beneficial to the patient, because whatever you work with the best is more likely going to work out better for the patient. Do you have access to a triturator, a capsule mixer? If not, Fujiautomix LC may be an option for that. Is the patient at high risk for caries? Then you want to consider, you want the highest fluoride release available. Again, this is not to confuse you. I want you guys to really think about what you're doing in your practice, the patients that you're seeing, and what option is available for you. Again, if you're already using these materials and you like what you're using, then great. If you're just confused, contact us. You know, we can set up virtual meetings. We want to assist you. We want to find out, you know, what's going to be beneficial for you guys. So again, the days of only using glass ionomers for class 5 is really no longer the standard of care. The materials have come such a long way. There are a lot stronger materials, and they can be used for a plethora of procedures out there. So, okay, so why wait any longer to make enamel stronger? Start saving and rejuvenating enamel. So again, this is the additional resources here. I'm going to kind of flip through this real quick because I want to get to the demo portion of it. I think we have a couple minutes left, so I do want to go into that real quick, and then we'll go into questions. So I'm going to stop sharing my screen here. I'm going to end my video, so bear with me. I am not a videographer, so I'm going to try to do this the best I can. This is my little makeshift little demo stuff here. All right, so all right, awesome. So I'm hoping you guys can see this. I think if I move back, that's a little bit better. Okay, so what I'm going to do is I'm actually going to go through a couple of techniques with you guys. I'm going to try my best to kind of suit up as if I am working on the clinical side. Obviously, I've washed my hands first. We're going to glove up.
Michelle, this is Karen. I just want to let you know there's 9 minutes.
Perfect. I'll get through this in like 2 minutes. Okay. So again, if you guys, this is the GC capsule applier. We recommend that you autoclave this, but if you want some extra protection, this is my makeshift. You know, you can actually wrap this up in a plastic wrap. So basically what you're going to do is, let me find my cavity conditioner. So basically what you're going to do is you're going to place the GC cavity conditioner on the teeth that you're trying to seal, okay? You're going to leave that on there for 10 seconds, and then you're going to use, after the 10 seconds is gone, you're going to use a wet cotton tip. Now, this is the modified technique if you're not using any air syringes. And then you're just going to use a soil cotton roll, and again, as long as the area is not pooling in saliva, you're going to remove that. And then what you're going to do is you're going to take this capsule here. Okay, what we're going to do is we're going to give this a couple of taps to fluff the powder, press down on that. We're actually going to stick it in this capsule mixer. "10 seconds, take it out. You can put it in your capsule applier like so. Give it 1, 2, 3 clicks. And I just want to show you real quickly on here, these dots. Now I'm going to mix another one too. All it takes is one of those little dots to do one individual teeth because it spreads really thin. So I just want you to see you can very easily get 8 teeth out of that one capsule, okay? So then what you're going to do is I'm going to mix another one and show you how to put it on the tooth. And I know I'm going really fast here, but I know we're running out of time and people may have a few questions. So again, capsule, tap, tap, press on that. We're going to put the, press on that. Put it in here. People get so hung up on the capsules, but it's really this easy to do. I would just say you can't be afraid when you're working these capsules. You're not going to tear these capsules up. You're not going to tear these capsule pliers up. Again, these things are very strong. Click, click, click. Put a little dab in the middle of the tooth. You can use your glove finger, smush, smush, and that's it. Or if you want to be a little more technique, you can put a little dab in the tooth. You can use your Explorer. You can do it like that. I feel like it's most effective if you use the smush technique. That's it. That's pretty much it as far as the demo goes. And I just wanted to kind of go over that with you guys. Did anybody have any questions? Or Adam, did you want to add anything to that?
I think there are a couple of questions. Can you hear me?
Yeah. Mm-hmm.
Only quick thing that we had discussed yesterday is if some of you are bringing out an old dusty Trader that's maybe been in the closet for years, as they get older, the mix times change. And so what we've encountered with some other groups is they pull out an old mixer, and it's kind of counterintuitive, but the older they get, the faster they mix. And so it mixes up the material much faster and it sets quickly. So you can adjust mixing times down. And or GC does have that mixer that Michelle showed, and we always have deals. So if you're just finding, gosh, this material is setting up way faster than it should be, give one of us a call and we'll help troubleshoot the issue, because you should have plenty of time to get it from the mixer into the teeth.
Oh, yes. And I didn't cover this, but basically from start of mix to full setup is 2 minutes and 40 seconds. So I think that's what, about 10 seconds of mixing time and about 1 minute and 40 seconds of working time. But again, if you have a well-behaved child, I mean, I've done them on my niece in like 40 seconds. So, I mean, it takes very little time, but literally that's why we think put a dab in the middle of the tooth, take your glove finger, work it in, go to the top, put a dab in the tooth, take your glove finger, work it in, go to the other side, do the other two, and that's it. So again, you don't need a whole lot of time, because everybody goes, oh my God, I don't have a whole lot of time. You really don't need a whole lot of time. So let's just say you finish up a few minutes, like a couple of seconds early. You can get them to actually bite down on a cotton roll. You can do that. Or sometimes if you have like a piece of plastic, what you like wrap your air syringes in, you can get them to bite on that until the full setup time is complete.
Cool. So there are a couple questions, if you want me to read them off real quick. Question is wondering about, does the conditioner have a taste? Oftentimes they're told that their etch tastes sour.
So yeah, the acid etch. So yes, I think there is a little bit of a taste with this. It's not as sour as that acid etch. So from my experience, I used to tell people if the acid etch gets on the tongue, the whole appointment's over at that point because they're gagging and they hate it. So there is a little bit of a taste. It's not as severe. I've seen doctors place it and it's not as bad. There is a taste, but it's not as bad as the acid etch.
Gotcha. The next one is on SDF and GI treatment. And I can answer this one. So if you are going to do any same day placement with SDF, then absolutely the material you want is to be 100% glass. And so either Fuji Triage or Equia Forte would work. Yep. Sorry, is there another? How long can you wait to apply the sealant after it goes in the amalgamator? You want to go right away. Yep.
Oh, yeah.
Yeah.
Mm-hmm. Yeah.
I think, or maybe another way to read that question is, if you wait like 30 seconds, it's going to start, it'll get difficult to extrude out of the capsule. So you do want to go straight from the mix into the mouth.
Yeah, absolutely.
But you should have enough time that you can go from like one operatory to the next, or your sanitation room if the mixer is there.
I was about to say, so it depends on how you're set up. So what I've experienced is like if you have a big office and like the restorative, you don't have a capsule mixer, and the restorative hall doctor is like way down the hallway, and you try to mix that capsule, run back down the hallway, get Johnny from underneath the chair, put Johnny back in the chair, get him to open up. You're getting into it will start to set up and you'll get very frustrated. So what we do recommend is that you have a capsule mixer either in the room, or sometimes two hygiene units will, like if they have the cabinets in between, they'll share a unit. So you do want it fairly close by. But do not get hung up if you don't have a capsule mixer. That's what Adam was saying. We work with groups all the time where we can we can probably get you some free capsule mixers. That don't let that be a hurdle, because that's a hurdle that we can overcome. So yes.
Yep. To rinse the tube, the GC America recommend using a Monojet syringe to rinse. I saw her using a cotton tip, but maybe a Monojet syringe would rinse a bit more.
Yeah, so I didn't have a Monojet syringe. I know I was trying to do the best I could. The main thing is you want to rinse the tooth off. So it doesn't matter if you rinse it off with an air syringe. It does not matter if you use a toothbrush, a cotton tip, a cotton roll. That's what I'm saying. I wouldn't get hung up so much. You want to remove gross plaque as much as you can. Place the cavity conditioner. If you got a Monojet syringe, great. Use your saliva ejector, suck it out. That's fine. I mean, yeah, don't get hung up on. Just rinse it off and go. Yeah.
Awesome. And talk about coming up on the wire. Last question from Todd was, do you think Fuji Automix LC is too thick to be used as a sealant? What have you heard from the people that are placing them?
So I've not personally placed it myself. I really would like to try to place that. The people that I do know that are using it, I don't think they've had any. Somebody may want to speak up on that. I don't think it's too thick. Again, it is going to be a little bit stickier than the Fuji Triage per se. So, I think it's just one of those situations. They make it work because they don't have a capsule mixer. Did I see a question about the
I think we need to end because I know they're on the account right after.
Gotcha.
Okay.
But there's a question about the difference between white and pink. So we can have you respond to that via an email, if that's
Perfect.
okay. So
Yeah.
thank you, Todd and Michelle and Adam, for joining us this afternoon, and thank you everybody else who joined from throughout Oregon, and we'll have conversations about this. Thanks, everyone.
Awesome. Thank you so
Bye.
much.
Bye.
Bye.
Bye.